Hi parents, this is Leslie Blevins from Enilda Clinic at enildaclinic.com. I am going to be talking about today autism and what it is. And if you have concerns for your child for autism, please make sure that you talk to their pediatrician. And let's get started. Okay, so autism is a lifelong developmental disorder, and it's typically diagnosed pretty early in the child's life, around toddlerhood or preschool years. But it's also pretty common that if you have somebody with high functioning autism, that they might get diagnosed a bit later in life. I've actually done diagnoses for people who are well into adulthood. And so recently we actually we changed the name to Autism Spectrum Disorder, and that is to reflect the wide variety of functioning and different types of skills and different types of impairments that a person with autism might have. And so yeah, let's jump into what kinds of symptoms represent autism. So there are two groups of symptoms. On one side, you have restrictive and repetitive behaviors. Overall, this is sort of representing a sense of inflexibility or rigidity. And so you see this with routines and transitions. And so the child might have difficulty stopping what they're doing before they reach a sense of completion and moving on. They might have to do something the same way every single time. They might have to say things a certain way. Sometimes that rigidity, we call it restrictive and repetitive behaviors. Sometimes it shows up with sensory difficulties. So they might either have an avoidance of certain types of sensory input, whether that's smells, sights, sounds, touch, even taste. So the number of foods they might eat or the textures of the foods they eat. Or they might be sensory seeking, where they strongly prefer certain types of touch. So they might, bump into people quite a bit. They might have a really strong touch, something like that. And then another way that we see restrictive and repetitive behaviors is with interest. This is one that shows up with our high functioning individuals quite a bit. This is where you might see it, I guess, more than some of the other ways that I just mentioned. And so sometimes you might have people who have just one interest where they really hone in on it, and that's what they like to talk about, and it's hard to get that person to engage in any other topic of conversation. Sometimes with a really high functioning person who has autism, they can actually build upon that interest, and they might go on and actually form a career out of it. I've known several professors who have autism, and so I think maybe a big perception if somebody's diagnosed with autism is that they will have tremendous difficulty, they won't be able to get a job, but there's quite a few successful people out there with autism. So anyway, but then on the other side of the spectrum, the limited interest can be quite impairing as well. So it's not to say that having autism is a huge benefit too. It's just how the particular symptoms all come together for each unique individual. And then the last way that a restrictive or repetitive behavior can show up is with repetitive behaviors. And so we call this stereotypy. And sometimes it shows up with different hand movements with your fingers and your hands. Sometimes it could be like your upper body, your arms. And so these would be odd mannerisms that are odd posturing, moving your body in odd ways. Just it typically is occurring because it gives some sort of sense of feeling good to the person, but it typically is not functional. So yeah, so those are restrictive and repetitive behaviors. And then we have on the other side, social communication. And so on this side, what you're really thinking about is the person is having difficulty connecting and using language in a way that is helping them to understand the other person that they're talking to, and to also convey what they need and want and mean to that other person. And so we can break this down into several different types of skills. So for social communication, we can break it down into verbal skills and nonverbal skills. So with verbal skills, whenever we're thinking about what we're actually saying, with social communication, we're really talking about pragmatics. And so we're talking about using language in a non-literal way. So thinking about things that are more abstract, thinking about ideas, maybe even thinking about wordplay. You can think about kids whenever they like have jokes and, you know, they start to use words in funny ways. Those can be pretty tricky for people that have autism. Sometimes sayings where, you know, the shoes on the other foot or something like that, that could be hard for a person with autism to understand what is meant by that, because they understand the literal meaning, but maybe not the figurative meaning. The other part of the verbal section for social communication is the voice that the person is using. So the tone of their voice, the pitch of their voice, the loudness of their voice. Many of those are pieces of how we communicate whenever we're talking to somebody in order to indicate how we're feeling, or just to get the meaning across of what we're trying to communicate. So if I were like being like really strong right now and talking loud, you would understand that I was being really emphatic, or maybe I was being angry or something like that. But people with autism oftentimes have difficulties with this. Not always, right? Because in our spectrum, you can have deficits in particular skills, but maybe not definitely having a deficit in any one skill or all of the skills. So outside of the verbal skills, then we have nonverbal skills inside social communication. And so these include things like eye contact. And so whenever we are communicating with someone, we actually gain a lot of information by just doing eye contact. And oftentimes people with autism might not use eye contact effectively in order to gain information in the social experience. And then the next one would be gesture. So like what I just did there, that was a gesture. People with autism sometimes aren't using descriptive gestures in a way to coordinate together all of the information that they're trying to convey to another person, and to also understand what that other person is trying to say to them. And so that kind of brings us to our last piece on the social communication side, and that's the coordination of all these verbal and nonverbal forms of communication. So it's what we're saying, it's that figurative language that we're using, that abstract thought, it's the tone of pitch and the loudness of our words, it's our gestures, it's our eye contact, and it's coordinating all of it together so that we're communicating a clear message, and also so that we're reading a clear message from other people. And so that's the social communication side of autism. And people who are diagnosed with autism, they typically have a sufficient deficit in that ability that it makes it difficult for them to interact successfully in social situations. So those are the two big things: restrictive repetitive behaviors and social communication. If you are concerned about your child and you are thinking about getting them diagnosed with autism, at this point, the only way to be diagnosed with autism is through a behavioral assessment, which would mean that you would go into somebody who's qualified to diagnose autism, and they would, you know, do various different types of assessments where they're truly interacting with your child and doing the social presses to see if your child can do eye contact, if they use gestures, if they can modulate their tone of voice, if they can transition smoothly across activities, if they have those restrictive repetitive behaviors. And so there's a lot more nuance to it. There's actually a lot of behaviors, but it takes a while. It takes a lot of observation to be able to kind of collect enough data to see, does this person have the skill set? And if they don't, is that deficiency enough to really say they have a disorder? Or is it autism, or is it maybe something else? And so you want to have a good evaluation that gives enough observation time with the clinician and with the child in order to rule out other possible deficiencies like a language disorder, social communication disorder. or expressive language disorder, and also looking at IQ and looking at adaptive functioning, just to be able to make sure that whatever the outcome is of the evaluation, that you have good information to go into treatment, because likely the reason you're coming in is because something's going on and you want some sort of outcome coming out of the evaluation to be helpful and to give you some next steps to support your child. There are no brain imaging techniques that diagnose autism, and there are no blood tests that diagnose autism. A 1-hour observation probably isn't sufficient. And we can start diagnosing autism pretty early, about 18 months to 2 years old. Now, if your child has, moderate to high functioning autism, sometimes it can be kind of hard to determine if it's truly autism or if it's just a developmental delay. And so sometimes there might be a diagnosis, kind of like a placeholder of, what, we're seeing some delays, let's go ahead and do some intervention, and then we'll come back a couple of years later after that good quality intervention time, and then we'll really either confirm or disconfirm whether or not there is an autism diagnosis. But for those kids that are clearly showing the autism, we can do it pretty early. Here at Enilda Clinic, I started doing autism evaluations at 2 years old. And if you're in the Spokane, Washington area, you can always reach out at enildaclinic.com and learn more about my services, and you can see about getting an evaluation there. All right, thank you so much for joining me. Again, if you do have concerns, also reach out to your pediatrician. Thank you so much. Bye.